Live from ZTN Studios in Harare, Zimbabwe. Hello, my name is Majita Samario and welcome to Heartbeat. Now, this program is brought to you by Zimpaper's TV network ZTN with the help of our partners, Consolidated Africa Services private voluntary organization, Kaz Pvo. We want to hear from you. Your contributions are important. So please make sure that you share your views and comments with us by following our Facebook page at Zimpaper's TV Network and by visiting our Twitter page at ZTN News. Now, welcome to the 8th Roundtable series for developing a sustainable business. We are so excited for you to join today's conversation that is inspired by the United Nations 17th SDG goal, which is to strengthen the means of implementation and revitalize global partnership for sustainable development. The goal is in line with our topic of discussion today, which will focus on how partnerships can result in sustainable development within mental health training and the implementation of services. I will be joined online by an esteemed panel of guests. We will have Mr. Fabian Musoro, who is the National Mental Health Manager at the Ministry of Health and Childcare. We'll also have Dr. Samson Mija, who is a chairperson for the Department of Psychology at the University of Zimbabwe. We also have Mike Zedi Chikukwa, who is the CEO of Chikukwa Research Trust in Chimanimani. And we have Ms. Tanatswa Chikaura, who is a mental health advocate. Hello, guests, and welcome to Heartbeat. Right, so I have just introduced the panel, but I would really like them to also just give a brief description of who they are and what their interest is in mental health in line with today's topic of discussion. So I'm going to start off with maybe Mr. Fabian Musoro. May you let us know who you are, sir, and what do you do, sir, and what are you doing for mental health? Hello, Mr. Fabian, are you with us?
Yes. Good morning. Good morning.
Hi, good morning.
Thank you very much for this opportunity. My name is Fabian Musoro. I'm the National Manager Mental Health Services in the Ministry of Health.
Okay. And your passion for mental health and today's discussion, what has spurred this, sir? This one. Unfortunately, I can't hear you, sir. May you please adjust your mic?
All right. Yes. Yes. I was saying mental health is my passion, is my way of life. I've been in the mental health system of this of Zimbabwe as a nurse for the past 12 or so years. And I'm working at this level, and every day I will always handle one way or the other mental health issues.
Thank you very much, Mr. Fabian. And how about you, Dr. Samson Mija? Can we have a brief background of who you are? Can you hear us? Are you with us? Or we can have Mike Zedi Chikukwa or Tanatswa, yeah. Whoever can go first.
Okay. My name is Mike Zedi Chikukwa from Chikukwa Research Trust. I am the CEO of this young people's organization or young people's collective. My passion for mental health is I've been engaged in actually mind training activities that involve mindfulness training, whereby we are also using our traditional ways or some community ways of dealing with mental health issues that involve storytelling, that involve drumming, dancing, theater, and things like that. So that's, something that I have passion for. And as a young person, I see a lot of, issues that affect young people. And we need to try and find ways of getting to, deal with them in a way that is actually enjoyable and that is not actually something that they can relate to. Yeah, thank you.
Thank you so much, Mr. Zedi. And how about you, Tanatswa?
Morning.
Hi,
Thank you
good
for
morning.
having me.
Thank you for joining us.
So, I am passionate about mental health. I'm a mental health advocate, and I really want mental health services to be accessible and affordable to young people. Every day, you will hear people saying, "Oh, you're a young person. What do you know about various mental health conditions? What do you know about depression? What do you know about anxiety?" So, there's a whole lot of stigma that's around it. And for young people, it's very difficult to access services.
Thank you so much. Thank you. Okay. Now, why is mental health a global concern, right? Well, mental health problems account for almost 13% of the world's total disease burden. It has the ability to impede social and economic development and impair the fabric of our communities and needs such as parenting, child development, and socio-economic success. Mental health disorders are also associated with some of the world's most pervasive human rights abuses. But despite these compelling examples, mental health is disproportionately and poorly funded around the world, especially in low and middle income countries. So, there are powerful reasons of why improving mental health in low and middle countries should be a key and global concern. And this is why we are here to look at the solutions. Now, allow me to do that. Now, we have a background of the Kaz Pvo, and the Kaz Pvo is the Consolidated Africa Services Private Voluntary Organization. Now, it is an independent body registered under Zimbabwe's PVO Act. Their main focus is on environmental conservation, mental health awareness, and initiatives that promote entrepreneurship development amongst women and our youth. Now, action can be taken to improve the conditions of daily life and to promote the mental well-being and prevent mental disorders from developing. This requires broad interventions across multiple sectors, so e.g. our environment, health, education, our social policies, and at multiple levels of family, community, and national levels. Henceforth, Kaz Pvo has various initiatives that include, but are not limited to, the following. We have tree planting, resilience training. They have partnered with the World Maker International, which is an international non-governmental organization that collaborates globally across disciplines to improve our understanding of human resilience and provide frameworks which include education and practical resources that continue to enable our communities to become more resilient than before, during and after adversity. We also have W for Life, which brings life to the role of conservation and wilderness. And we get to see how these play together in improving mental well-being in sub-Saharan Africa. And of course, we have wellness festivals. Now, to execute their goals, Kaz Pvo has community welfare nursing. A community welfare nurse is a member of a local community who is trained to assume a welfare nursing role within the community, catering for the psychosocial mental health needs and support the community they have reside in. We also have community wildfire rangers. Now, a community wildlife ranger, CWR, is a member of a local community living either or on the periphery of a national game park. Now, it could also be in a management area or other part of the country where coexistence with wildlife is a part of everyday life. They help manage the inevitable conflict created by the coexistence of human life and wildlife. And lastly, we have the Community Incubator Fund. Now, this fund is set up to support women and young entrepreneurs so that they can build long-lasting and sustainable business with the support of their community. That's it. Exciting. Now, we are about to delve in to the crux of our discussion, and I'm going to be helped by our lovely panel of guests that I managed to introduce earlier, okay? So I'm going to start off with, I think I'll start off by asking Mr. Chikukwa a few questions. Is Mr. Chikukwa on the line with us?
Yes.
Hi, Mr. Chikukwa, how are you?
I'm good. How are you, Majita?
I'm very well, thank you, Mr. Chikukwa. So, Mr. Chikukwa, you are the CEO of Chikukwa Research Trust, right, in Chimanimani?
Yes.
And I'm sure, like, as your research suggests. You have gathered a lot of research. So what have you gathered in terms of mental health?
Okay. What we have actually gathered in terms of mental health includes mainly looking at the children. Since we have been affected, let me say, by the previous not pandemic, but the disaster, Cyclone Idai, we have realized, children quite so much disturbed mentally. Some, they were actually, urinating in class, which was actually a sign of, mental disturbance. And whenever there was some kind of heavy winds, or when it's about to start to rain, you would actually see them running out of class. That has been some indications of this, some kind of trauma that they actually live with today. So, and also, I've noticed a lot of loss, especially to some other elderly people, like family people who has lost their loved ones. And during that time, they've actually looked for them, and they couldn't find them. They've been, swallowed by the rocks and mud. So those people were just lost. So those people live with grief. And through that, you would find out that at times people, or those who are still with us, who are still alive, they do some hallucinations. They, at times, talk on their own. I'm sorry, I'm not a psycho person, but I'll describe the situation. To those who are well educated can really understand what I'm saying. So they are living with those memories. So living with those memories really, makes them not to function well, even, whenever communicating, whenever interacting, and even the work that they used to do cannot even do properly. We have also realized that some have lost even their cropping fields, and you would realize that hunger is becoming an issue, and some, they walk around, asking for food. So we have gathered quite a lot in that, and that has also have an implication, to the food systems within the community. So you'd find out that the bread basket is actually, deteriorated. So, in a nutshell, I would say that's what we've actually gathered in terms of the well-being soon after this disaster. Furthermore, you would realize that apart from that, we have also other people who has got issues, let me say, issues to do with there might be ngozi, and how to deal with those, mentally disturbed or mentally challenged people within the community. There is some kind of need to socially accept them, because usually they are regarded as these people are not, people that we can, relate to. These are people that we can just, sideline. But in actual fact, it's not something that is happening while they are knowing. So through some kind of mental activities that I was just like mentioning, through drumming, through some kind of mindfulness training, whereby you need to reflect to your own thoughts and look at yourself within yourself and see how you are relating to your own mental dialogue, I would say. It's something that we have seen yielding some results to some who were not really seriously challenged by the losses and by the, the traumatic events that they've been, encountering in life.
Thank you so much, Mr. Fabian. And I'm definitely going to get back to you so that we can delve into that some more and maybe get some recommendations from you. But I am going to move to a psychologist now. So, Dr. Mija, from a psychologist's perspective, why is mental health and psychosocial support so important, especially during this COVID period?
Hello, can you come again?
Why is mental health and psychosocial support so important, especially during this COVID-19 pandemic?
Well, mental health and sexual support are very important because human beings can only flourish, like you've said before, when they have actually their sexual well-being catered for, their emotional well-being, their social well-being attended to. So basically, mental health is not necessarily the absence of diseases, disorders, or mental health challenges, but it goes beyond that, where a person is well adjusted in their community, in their relationships, within themselves in terms of their own emotional functioning. And when a person has that emotional well-being adjusted, they're able to cope with the normal stresses they face in their lives. They're able to contribute to their own community. They're able to be productive in whatever they do. So it's actually very important that mental health issues are addressed. And like I've said before, even when a person has other health issues, those can affect their mental health. And should their mental health be attended to, it can also help them deal with all other health challenges. You know, we're talking actually of comorbidity here. When a person is TB, but if their mental health is well attended to, then they can be able actually to deal with those issues to do with TB. Now we are talking of this COVID. The COVID pandemic has led to there's led up to come in force of new issues, new ways of life. Now we're talking of social distancing. We're talking of actually staying with this mask all the times in public. Now the COVID creates problems because people actually are afraid of dying and relatives are dying, which creates issues of loss, grief, which actually also need to be attended to. Then, even when we deal with those issues of grief and loss, that person, they also are actually worried that they can also die themselves, because nobody we can say is immune to this pandemic, which has created a lot of problems to many people. So this issue of mental health is very fundamental.
Thank you so much, Dr. Misha. So you even spoke about grief, we spoke about loss, anxiety, and death. I mean, we are restrained, we can't, we have travel restrictions and all of that, loss of income as well. Now, what are some of the ways that we can safeguard our mental health then during this difficult time? Dr. Misha, I'm going to come back to you right again. As a psychologist, how can we safeguard our health?
Of course, there are so many ways, and there are people who are trained to help us deal with those mental health issues. Somebody can approach the licensed clinical psychologists who are around, who are with us, the counseling psychologists, we even have psychiatrists. A person can also engage in many other activities, like being physically active, a walk, going to the gym, being in one's environment, even using one's own belief systems, praying to your own God, being around your relatives, your friends, even if you cannot be physically, but you can still be so virtually, helping others. We know that sometimes you may have so much to spare so that you can give those who are struggling. That can still also help yourself if you are giving to others who are less fortunate than yourself. So there are so many ways. Being in one's environment, those activities can help a person to achieve mental health.
Would you
mental
say,
well-being.
would you say that like mental health is maybe like a neuron disorder then? So maybe things like self-affirmation could also help, because if an environment is toxic and some, you know, gyms were closed, now if you're vaccinated you can go. But I mean, if you have nobody around you, no access to gyms, and you're just by yourself, what can you do to fill our empty vessels alone?
Well, so sometimes actually people read literature. They can be reading novels. They can see even being physical active on their own. You can even exercises that you can do on your own. Even addressing your...
Unfortunately, we can't hear you now, sir. May you try and fix your mic just a little bit? No, we can't hear. But I did understand your point, though, that we can do a lot on ourselves. We can do a lot to fill our vessels. We can exercise, we can read literature, we can dig deep, we have self-affirmations as well. I'm going to speak to Mr. Musoro, who is from the Ministry of Health and Childcare. And I want to find out, you know, what the ministry has noted with regards to mental health during this COVID-19 pandemic as well. What are you seeing? Maybe in children.
Thank you very much. You know, let me start by saying the coming of COVID-19, unceremonious coming in 2019, and its pandemic has adjusted our lives because it found us unprepared, and it has forced us, and I mean, let me say, it forced our minds to function in an emergency mode. As a result, it led to everyone running around, running for their lives as if chased by lions or a group of hyenas. That fear is all over. Let me tell you that fear is everywhere in the world, every corner, everywhere. In Zimbabwe, fear of unknown, fear of death, as we are experiencing many deaths, and fear of losing something precious, you know, something that is important, and general fear of the unknown. Let me say that. So what basically has happened, and what we have noted, is that so many adjustments have taken place. Adjustment to survival, and, you know, coming up with the new survival technique during the pandemic. In a good way, preventive measures have been put to curb the transmission of the virus, but somehow mentally it has been hurting lives out there. It didn't spare anyone according to their status in the community, whether they are rich, whether they are poor, whether they live in town or they live in the rural areas, whether they are powerful, very powerful, and they do not have power. The COVID-19 didn't spare anyone. So these preventive measures somehow have put so much pressure on individual in their kind of society they are living in. And we are noting that there are so many increases in post-traumatic stresses, and we are highly likely just waiting to have some studies that have post-traumatic disorders, probably post-COVID, post the pandemic. You know, we've got so many uncertainties now. No one knows what the future holds. You know, the joy of life is to know your vision, to know where you want to go, and you're starting to walk in that direction. But somehow, for us, where we are going, we are not really sure, and how to go even in any direction that we are going. It's not really that clear. There is so much change that is taking place, change of order of things. We have got a normal routine that we have. It has been adjusted. Some people have been fanatic socialists, you know, liking to go out there, enjoy their lives, mixing up, as we are social animals. So that has already been cut down and put so much pressure on people. Life being reconfigured, moving to normal mode, to survival mode, it's really painful. People currently have got their own burdens in the community, and to add more, here is COVID, putting so much pressure. And once that happens, we are talking about mental health here. We are talking about individual health. We are talking about people suffering. And the most dangerous part of it, as they are adjusting and coping, they do not realize that somehow they would need some mental health checkup, they would need some form of counseling, and before they actually have a diagnosis of some sort, or a severe mental illness.
Okay, thank you.
Which is mostly known.
Thank you
very
so much, Ms. Again, we are going to delve in because this information is jam-packed and there's a lot of it, so we can't wait to share it with you. But I'm going to move on to safeguards. What safeguards do we have in place? Now, Mr. Chikukwa, our government has repeatedly said that it is committing to promoting mental health in Zimbabwe. And in your opinion, do you believe that the government has actually managed to back this statement up with tangible action? Mr. Chikukwa.
Yes, I can hear you. Can you come again with your question?
I said that our government has repeatedly said that it prioritizes mental health and it's been promoting it. So in your opinion, do you believe that the government has backed this up with a tangible action? Is the government doing enough?
I would think, from my own point of view, through engagement of some other civic society organizations, we have seen, I'll give an example of where I am here in Chimanimani. We've seen the engagement of Miracle Mission, who came to assist. But honestly speaking, I wouldn't say it's enough because we are still, living with that, and some continued support, I would say, is required till, we are able to cope up and we are able to live with these things that actually affect us mentally. And as well, we need to have like some self-care trainings that actually help us as individuals or us as communities, so that whenever we are entangled in these kind of things that disturbs us mentally, then we can also be in a position to help ourselves. So I would think much work still needed.
Exactly, but what do we have in terms of legislation, if you know any, to protect mental health and government programs? What's out there?
I'm not really well versed in terms of legislation, to be honest.
Okay, but any protective measures that you're aware of that are, publicly funded, privately funded, anything?
No.
Do we have official institutions that can help us when we talk about mental health in Zimbabwe?
The only thing that I know is like here at our mission hospital, like in Mtambara, I think we have one psychiatric, or it should be one or two that we have around Chimanimani or around Manicaland. So looking at some ways or some, let me say, some care or some help that might come from them, you'd find out that one out of maybe a district with over 140,000 people or two people cannot really go and be served by one or two psychiatrists. So there's still need for more of those people to be, to be around us and to be actually close to us, so that whenever we need help, they can be there to assist us.
Correct, and this is why we have to stress the importance of partnerships, right? And that's why we're talking about sustainable development within mental health training and implementing these services. We have to start implementing, so it goes back to the crux of our discussion. Thank you for that. But let's focus on the general state of Chimanimani, though, especially residents that have suffered a series of casualties, Cyclone Idai and COVID-19. Now, research shows that many of these people have suffered from post-traumatic stress disorder, losing income, families, lives, people going missing, losing their livelihoods, crops, horticulture, everything. So let's talk about that. Like you said, do we have enough people on the ground that can actually help heal our people?
At the moment, we do not have enough personnel that could actually attend and help our people. Of course, there are some other organizations that are coming, with access, like access to water, clean water, building some damaged schools. But if you look at the COVID regulations today, you'd find out that even with the number of blocks that we might have, say, per school, they are not even enough, and some have already been damaged. and then they'll have to have some morning sessions and afternoon sessions, so that we could actually be according to the regulation. So I would say there's still a lot that needs to be done. Even provision of permanent shelter, for an example. You'd find out that, of course, efforts are being done by various stakeholders, but still today you'd find out some people do not have permanent houses that they've lost. Some they're still living in shacks and tents.
So I understand these issues, but who would you like to partner with? Especially since you're in Chimani Mani and you know that this is what's happening. What partnership would benefit you? Or what series of partnerships would benefit you so that we can achieve this goal?
Okay. I wouldn't know who would be really, out there to really offer help because of my limited knowledge. But I would suggest if we have got those who might need to assist in terms of trauma healing, that is maybe to sort of rebuild or reweaving the social fabric that has been destroyed. Also, some livelihood recovery projects, as in terms of agriculture, because agriculture is the main source of life for many people living within the rural communities. So you'd find out that there is need, in terms of inputs, in terms of actually what they need. So I would think sort of a baseline survey would guide us into addressing the real needs of the people.
Thank you so much, Mr. Zedi. Well, we can't wait for that survey, especially from your research trust, since you are on the ground. Now, fortunately, a growing body of research is showing that cost-effective solutions to mental health challenges actually exist. Now, these include improving social and economic environments as part of sustainable development so that mental health problems are likely to occur, integrating mental health into generic primary health care, using trained and supervised community and non-specialist health workers to provide culturally appropriate care and treatment in the community. We also have harnessing technology so that we can build a workforce capacity which connects our people with specialized help and increases access to self-help. Don't worry, Mr. Fabian, I just want to go run these through. Empowering with mental health problems to support and advocate the greater rights and representation for people with mental health problems. We also, have community guidelines. So I guess there is a lot of cost-effective things that we can do. I'm going to switch to Dr. Mija now. Thank you so much. Dr. Mija, are you on the line? You ready?
Yes.
Okay, so do you believe that we're equipped with sufficient information and resources to tackle mental health in Zimbabwe?
Hello? Can you hear
Hi.
me?
Yes, Dr. Mija.
Yes, we do have the resources, but I think our challenge is in terms of coordination and partnerships, like is the goal for this session. In developing countries, they've conducted a lot of researches, results of which we are using now in Africa, and where sometimes the environments are not similar. It is very important that the government, represented here by Ms. Dimsoro, tertiary institutions where we are coming from, and private organizations where we have CAS, Consolidated African Services, and even the organization that is represented by Mr. Natwa Chikaura, coming together. I'm actually very happy that Mr. Z. Chikukwa is heading an organization that does research on these very pertinent issues in the communities. But what is important is that people should be coming together to conduct these studies, to be able to determine what works in our context. we wouldn't want actually the try and the error approaches, especially when it involves human health. But all the same, I'm actually impressed by what you've done.
Mm-hmm.
It's imported established methodologies, approaches from the West, but then it conducted its own studies so that they could come up with globally recognized approaches, but that blended with locally acceptable approaches. Because sometimes we may have things that work in America, but when you go to Chikukwa and Chimaniman, when you are at Nedziwa and Chimaniman, the people, they may not understand or agree with those approaches that have been generated elsewhere.
Mm-hmm.
That's why we in terms of actual even healing, there are issues such as deferring to spirituality, where the dead in our context are still living, and we still need to deal with them in order for us to heal after having gone through a traumatic event.
Mm-hmm.
So what is very important is that people come together, studies are conducted, and it's very important that we are bringing in this session organizations, tertiary institutions, where actually I'm getting a department at the University of Zimbabwe. Department now, it's from last year, we now have a new name, applied psychology.
Mm-hmm.
It's no longer just academic, it's applied psychology. Things that work in the real communities out there, in the context of Education 5.0, doing things that work for the people in our environment.
Right.
So,
what wasn't working though? I want us to talk about the gaps. Let's talk about the gaps and how you've bridged it from academic psychology to applied. What wasn't working?
The issue is we still need to be able to look at what approaches are being done, are being followed, are being implemented by the practitioners, and try to conduct studies and look at the effectiveness and efficacy in our communities. Suppose we go with those approaches
Mm-hmm.
to Chikukwa. Suppose we go with those approaches to Cholocho. With those two work the same way they work to the communities from Borodeway and Harare. We actually have in the process of establishing psychology.
Mm-hmm.
And we are actually getting some material support from organizations around. CS, we're actually even talking with CS at the moment so that we can come together, forge partnerships, so that we can do studies. We can be able even to train lay workers who can be able to do interventions on the ground. But what is very important is to be able to develop approaches that work for the people here in Zimbabwe, not just taking approaches, uprooting them from the UK and going with them to Chipinge and asking an old woman who really believes the things that are different
Mm-hmm.
from what is believed in the UK.
Mm-hmm.
So that's our challenge. That's why actually, even though we have some of these approaches, but people are not worried. People don't approach clinical psychologists. People don't approach counselors, especially those who are out there, because possibly what they believe in is not what is actually being actually implemented, those interventions. So we need to be able, as a country, as a people, as communities, to be able to generate approaches, the interventions that work for ourselves. And with us also being able to develop some of those approaches here in our country. The expertise is there. the finance, the government there.
Mm-hmm.
But the issue, the government, which actually should be offering regulatory supervision is there. But the coming together of all those stakeholders is what is important. And actually, I thank you for actually hosting such a very important session. I was not even aware that we have research trust in Chimani, who are doing such studies. But it's actually important that Mr. Zedi, the CEO, we come together so that we can be able to assess the efficacy and effectiveness of the approaches that are being offered there. So that if they are actually proven to be very effective, they can still be taken to Mount Darwin. And the government is there with its regulatory, so that whatever is offered to people out there is proven to be safe and healthy and very beneficial. So that sometimes we can even take those interventions to Mozambique. We can take them to Zambia, which actually gels well with the new approach in terms of higher and tertiary education in the country at the moment.
Thank you so much, Dr. Misha. That was really informative. I really enjoyed that. But let me ask Tanatswa a few questions. Maybe she can contribute because she is our mental health advocate as well. So, Tanatswa, can you hear me?
Yes, I can.
Hey,
Can you hear
Tanatswa.
me?
Yes, please, girl. Can you give us some of your contributions on what we just discussed with Dr. Misha?
Okay.
Let's talk about
So I
implementation. Feel free.
Sorry?
You have
Please
the
can you come
stage.
again?
You have the floor. Feel free. We want to hear your input.
Okay, so I definitely share the same sentiments with Dr. Misha. It's very important for us to do research so that the services we have are culturally appropriate for the Zimbabwean community. And just like how Mr. Musoro and Dr. Misha said, the COVID-19 pandemic has changed our lives, what we do. As a young person, we didn't go to school. We didn't go to school for 3 months. We were learning from home. That changed a lot for me. And having conversations with people in my age group, they would ask, okay, where do I go if I want mental health services? So in the mental health discussions we have, people are asking for accessibility and affordability. Who do we go to? And when we go there, can we afford it? And affordability is a big issue when we talk about mental health services. What are we doing about that? Who are we partnering about that in those areas? Are we partnering up with the medical aid societies? Do people know that their medical aid covers therapy? Do the medical aid societies themselves advertise that you can get mental health services from us using our services? So there's a lot that needs to be touched on, but I definitely do share the same sentiments with Dr. Misha as well as Ms. Damso.
Thank you, Tanatswa. Thank you so much for that. I'm definitely going to come back to you because I really want to pick your brain a little bit more. I think it's really cool that you're a mental health advocate. But let's go back to Chimani Mani because we're talking about PTSD and we've been talking a lot about, Zedi Chikukwa. So, Zedi, are you on the line? What's the significance of partnerships in the road to recovery for Chimani Mani? And how have your partnerships benefited you and what needs to be done?
Okay. What I would say is we have benefited a lot of psychosocial support and some livelihood recovery, as I've said, is on the way. Some infrastructures, like roads, some bridges have been constructed, but as I was saying, even the shelter is not enough, especially in some schools. What I feel needs to be done at the moment is to try and find some creative ways of intervening, exactly as what Dr. has been saying. We need to find some culturally acceptable means and ways that actually concur our context as local communities, because having some methodologies, I would give an example of one method that has been used to work with child trauma. It's called Singing to the Lion, whereby the kids are trained with some games whereby they deal with fear. It's actually I would say it's a Western methodology, but trying to apply it in our African context, you'd find out that at times kids could not really relate to. So some work needs to be done in terms of really getting content or approaches that really work with us in an African setup. For an example, we have the roles of tetes and mbuyas and sekurus and all those things. Those are structures which were in place that people could use and trust. And the sekurus could have, and the mbuyas could have time with our sekurus. Such kind of we might look at it as old practices, but you'd find out at times it can sort of regenerate the social fabric within the communities.
Thank you so much, Mr. Chikukwa. I really like the fact that you said families play an important role in partnership as well. So it's not just like non-government organizations or just general organizations. Our communities, our friends, people we call family. We need to partner with them so that we can, try and alleviate the effects of mental health on our citizens.
Yeah, and as well to add on to that, there is need to have some preparedness and some response strategies in place whenever, so that whenever something is happening, we are looking at, Cyclone Idai as an effect of climate change. For an example, a lot of rains, unpredictable and things like that. So if there is some preparedness and some response strategies in place, you'd find out that people can be put in, I would say, safe zones or protected areas where such things could not really affect them. And as well as, working on our environment, like growing trees, I would see something that needs to be done, because that kind of microclimate is something that, can actually benefit many communities, because we are more like on the watershed area where many rivers really start from here. So, growing of trees, no matter what kind of trees, but those trees that remain, like income trees, indigenous trees, things like that.
Thank you, Mr. Chikukwa. Now, going to the Ministry of Health and Childcare, I want to find out from Mr. Musoro about what he thinks. Now, Mr. Musoro, are you with us? Mr. Musoro? Microphone working? Hi, sir. Hi, how are you?
Very fine.
Okay, so I would like to find out how the Ministry of, Health and Childcare is handling mental health. What are you doing? What programs are there? What strategies do you have, since we've spoken about the importance of having strategies in place?
May you please come again?
No problem. What is the ministry doing to, ensure that mental health is important? What programs, what strategies do you have in place?
Various activities that the ministry is rolling out, and the first thing that I would want to acknowledge what Dr. Mesha raised and what other presenters were reckoning was the issue of coming together as an approach. Really, it is one focus of the ministry where we are actually welcoming partners on board, those who are interested to work with us, and we are also encouraging partners out there who are dealing with mental health issues to come on board, to come, and we know each other, we know what they are doing, we exchange notes, then we build one way forward. And the other areas that the ministry is currently doing is we have got a various of activities that we have. Recently, we launched our special initiative for mental health, which is quite an approach with about 7 very critical areas to look at. And that document, that document, we're actually using it as an approach towards giving of mental health services to our nation. And we are encouraging partners to come on board so that we assist each other, we make a way forward, and then mental health services are provided. Currently, we are doing psychosocial support in different parts of the country, assisted or in collaboration with UNICEF, with the World Health Organization, and that is last year we had assistance of UNICEF. And this has given us an opportunity to be visible, at least, and also sensitize the health leaders and other stakeholders in the community that mental health indeed is a priority, is a need, and everyone is responsible about mental health services, not only mental health experts, or not only to wait for a problem, a mental.
Okay. Right, Mr. Musoro has, he's gotten frozen from there. So I'm going to speak to Tanatswa now.
In our call.
Hello.
Hello. May I ask that...
Hello. Hello?
Musoro?
Hello?
Hi. Sorry, I'd already moved on to Tanatswa. I'll let you finish because it did pause. But may I ask that our guests kindly put themselves on mute so that we don't have to hear background noise when we're discussing things with the chosen guest. Okay, we've lost Mr. Fabian. That's okay. Tanatswa, can I please bring you back?
Yes.
Hi, Tanatswa. Okay, so what do you think, as a young person, what do you think has been the reception of mental health in Zimbabwe? Is it being prioritized?
So, as a young person, I will say that mental health has not been prioritized by us as young people, as well as by our elders or parents, but it's now becoming an issue. It's now becoming a topical issue. And I think that has to do with the pandemic coming and also seeing prominent people talking about mental health. People are now thinking, okay, what is mental health? What does it mean? And in these discussions, we realize that people still think mental health conditions are selective. People think if you come from a certain background, you cannot experience mental health conditions. And that is not the case. So there's still a lot of work to do, because in a population of over 14 million, I still think only about 10% actually talk about mental health and understand what mental health consists of.
Thank you. And tell us more, what can we do to make sure that we improve mental health, and maybe within our families and communities, what can we do, Tanatswa?
It's definitely important to raise awareness. Education is knowledge is power. That's what I always say. It's important to raise awareness about mental health. But at the same time, just raising awareness is not enough. What role are we playing? What role is the health sector playing? What role is the family playing? What role is the government playing at policy level? What policies are being put in place for us to get to the level we want to get? What programs are being put at primary level? Are we teaching kids about mental health? Is there a life skills subject that is mandatory for students, for individuals to know what mental health is? Families, parents, we're now talking about mental health, but our parents didn't talk about mental health. What are the parenting styles they're using? Do parents understand that themselves can be triggers for various mental health conditions? And are the parents willing to let their children get the mental health services? What role is religion playing? This is a big institution, and it should never be left out when we have mental health conversations.
Okay. Thank you, Tanatswa.
There's a lot.
Is your feedback okay? Is everything okay? So that I can have Tanatswa back on the line. Everything is okay with you?
Yes, can you hear me?
Woohoo. Okay. Sorry about that. We're getting a bit of feedback and the feedback has stopped. Thank you. I think one of our panelists dropped the line. So I'm just going to make sure I just have a rundown to make sure everybody's still online. Do we have you, Mr. Fabian Musoro?
Yes, I'm here.
Dr. Samson, do we have you?
Yes, I'm here.
Do we have you, Zedi Chikukwa? Zedi Chikukwa? I think we've lost Zedi Chikukwa. Okay, and we have Tanatswa. Right. Tanatswa, sorry, back to you. I want to find out more about you being a mental health advocate, because maybe we can inspire other people to join you. So tell me, what do you do as a mental health advocate? What is a mental health advocate to those that are watching and might actually be interested in participating as well?
Thank you for asking that. I get that a lot. People always say, okay, what is a mental health advocate? A mental health advocate, basically educates people about mental health, what mental health is, various mental health conditions, and where people can get mental health services. That is what a mental health advocate does. That is what I do. I want people to understand what the mental health risk factors are. Right now, it's September. It's the month of raising awareness on suicide prevention. What are the suicide risk factors? Who can you go to? How can we prevent it? What roles can we play in our communities? How can we then push for policymakers to implement certain things? That's what a mental health advocate does. Everyone should be a mental health advocate, because our mental health is a priority. Your mental health is literally your wealth. So we should all advocate for it.
So give me some self-love, self-care tips for somebody who's watching and they're dealing with mental health issues. Maybe you don't like your job, maybe you miss your friends, maybe you have travel restriction, maybe you have loss of income. Give us things that people can do in their homes so that they can alleviate the effects of mental health.
Definitely. When the pandemic started, people started working from home. People started learning from home, and you'd realize some people would enter their online meetings without even bathing. Some people would not bath at all. It's always good to take care of yourself. Just groom yourself, bath, wear your nice clothes. Don't let yourself go. Take care of yourself. Show yourself love. Practice the 5 self-love languages. Give yourself positive affirmations. Look in that mirror and tell yourself, I am so beautiful. I am so amazing. Spoil yourself. Buy yourself chocolate if you like chocolate. Buy yourself clothes. Buy yourself shoes if you like that. Spoil yourself. Don't be afraid to do nice things for yourself. And always be kind to yourself as well. And set boundaries. Setting boundaries is the first step to protecting your mental health. Have boundaries with people, and don't let people come into your personal space if you're not comfortable with it. Set those physical boundaries with people. Set those emotional boundaries with people, and don't let people abuse you.
Right, but it could be so hard to set boundaries sometimes, because then you could start feeling negative. Did I really have to cut you off? Did you have to make me cut you off? Am I a bad person? How are we going to prevent that?
Definitely.
Right? Mental health is
you
tricky.
have to be very brave to set boundaries. You have to be brave. You have to be consistent, because sometimes you need to stand your foot down and say, I don't like this. You're going to look at me in a certain way, but to protect my mental health, I do not like it, so I'm not going to do it.
And do you think that there are sufficient places that somebody can seek help with if they need help with their mental health? I mean, I'm aware of Friendship Bench, but do we have any free hotlines? I think there's also Christian Counseling Center. Can you give us some resources?
So we do have some resources, but definitely more can be done. We do have the Friendship Bench, like you mentioned. There's also Phoebe. There's also Phoebe, like you said. There's also the Christian Counseling Center. There's also the therapist support group. There's also in the University of Zimbabwe Psychology Clinic. So there are services that are there. There's also the Zimbabwe Psychological Association, but these services are not enough. Again, like I said earlier on, we have a population of over 14 million. These services are not enough.
And
more
some of
needs
them
to be done.
And some of them are actually expensive, aren't they? Because, people that try to commit suicide, there are places, in the leafy suburbs of Bardale where they have the private rehabs. But it's really expensive to be there, So now how are you going to justify this cost to your family who don't even understand mental health? Now I'm going to ask you, how can we get our family members to understand that, you know what, I'm not just being dramatic. This is not just a bad day. It's been a bad day for a very long time. I need help. How do we get them to understand that? You got to be strong.
We need to have
you know?
We definitely, parents will tell you, you need to be strong. Usayeme, don't just, you're being over dramatic. Don't over dramatize everything. We need to have more conversations with parents. Panels like this, we need to have more of them with parents. Parents saying what they feel and what they think. Because parents also have their own perceptions on these issues. They have their own feelings as well. And even with disciplining their child, they might think it's discipline, but again, it might be borderline child abuse. You never know. It might be borderline emotional abuse. So it's important to educate parents to know how they can then deal with issues if their children are doing this. How best do they interact with their child if their child is not feeling well? And I'll give you an example of a mother who has a girl child who has just started her menstruation. There are a lot of changes that can happen when a child starts her menstruation. Before your period starts, you might have pimples all over your face. You might start feeling so self-insecure. You will lose your self-confidence. And as a mother, you will see your daughter and you start saying, look at those pimples, look at you, what is not going on? And you won't know the effect these things have on your child.
Even society saying,
so
you've gained weight.
Conversations we need to have. What are you saying to your child? What kind of energy are you giving your child? And they might not know. They might not know these things.
I like that, Tanaso, exactly. But I mean, not just even family, like to the viewers that are watching, sometimes when you see somebody, don't say, oh, you've gained so much weight. Oh, you've lost so much weight. Oh, how far with school? Or, you're past 20 something now. How far with getting married now that you finished school and now that you have a job? Like, some of these things will unfortunately affect people's mental health. So I think if we're kind of sensitive about some of the things that we're, giving to people and some of the things that we're asking people, then maybe we can also try and help alleviate the burden, right? And let's see. Could you give any advice to young entrepreneurs or people whose businesses have been affected by COVID and are suffering from, mental health issues? Let's go back to the psychologist, our doctor. Let's go to Dr. Simon Mija. Is Dr. Simon Mija here?
Hello.
Hi, doctor.
Yes, how are you?
Fine, thank you. Just want to get some advice for you because unfortunately we are about to round up. So I wanted to find out if you can give some advice to people that have lost their jobs and some people that are entrepreneurs and, have suffered because of the COVID pandemic. What can they do to ensure that they stabilize their mental health or to make sure that they don't, fall into issues with mental health?
Okay, maybe the first thing is to accept the situation as is. Sometimes a person may be used to living maybe a life that is maybe costly. But when they lose their job, they lose their economic opportunities, maybe it's important for them to adjust down. And it's also very important to seek help. Normally, people stigmatize mental health problems, so they don't want to even express themselves that I'm not okay. It's very important that people express it when they feel so, and that they seek help to those who are there who can provide that help. Like Tanat has been saying, or what you also have been saying, that there are many places where a person can get mental health services, sometimes even without paying for them. But it's also important that we approach such service providers. Then there's this issue. It's also important sometimes to approach our religious leaders, our pastors, our prophets. But then there's an issue. Tanat has mentioned that religion is very controversial and complicated when it comes to issues of mental health, even just health, health in general, because sometimes they worsen the problem. Studies have been conducted in Zimbabwe, concerning who the people trust amongst the different stakeholders that are there. Religious leaders have been cited as the most trusted by many people in our country. But unfortunately, many of these religious leaders have wrong conceptions of issues to do with actually health. Sometimes you can get a religious leader stopping people from accessing health services or even mental health services. That's sometimes very, very dangerous to the health of their congregants or to those who trust them. The other issue is, you know what? When a person, for example, they're at a funeral, sometimes they feel like they want to mourn, they want to cry over their deceased relative. But sometimes religion stops people from doing that. So it's very important in the context of actually forming and forging partnerships for mental health. It's very important that the institutions and even religious stakeholders come together and agree on what to do and what not to do for the benefit of the Zimbabweans out there.
Thank you so much, Dr. Mija. Well, let's focus on recommendations from our esteemed panels. But I'm going to ask each of you first to tell me why partnerships are so important, because you do know, the crux of our issue today is on sustainable development within mental health training and implementing services. But it all happens with solid partnership. So, Tanaswa, back to you. What is the importance of partnership to you? And if you could work with anyone or partner with anyone, who would you like to partner with to ensure that we implement our mental health services?
Great, thank you for that. So when we are talking about mental health or raising mental health awareness, education alone is not enough. It's not enough to simply say, these are the mental health conditions that are there, these are the symptoms. The trainings that we do, they need to be more inspiring, they need to be more engaging, they need to be informative, yes, but they need to be practical as well. We need to have sustainability in them. There needs to be a structure to the training, whatever training you're going to get, whether it's to be a peer counselor or the trainings that they do then get when you become a certified psychologist. You need some form of structure. In the peer counseling trainings that do happen, what structure is there? We know that there's cognitive therapy. We know that there's systemic therapy. We know these are the things that are there, but we need a structure. We need it to be informed. We need research. We need to make what's there, what we are being told, we need to make it culture specific. We need to put it into context so that it's applicable to different communities. So it's very important. And I think partnerships with the World Health Organization, for example, right now they are partnering with the Ministry of Health to do the special initiative for mental health, which is a very good cause. And I think it's going to make a difference in our country. And we will need more partnerships as well with the United Nations and various organizations, the medical societies, as medical aid societies as well. They can play a huge role.
Thank you, Tanaswa. Mr. Fabian Musoro, how can we strengthen our provision of mental health services? And how can we also strengthen our partnerships? What are you looking for in a sustainable partnership? Mr. Fabian? Hello? That's okay. We can move on to Dr. Mija. Dr. Mija, are you on the line?
Yes, I am.
Okay. Would you like me to repeat the question? Because I am just trying to ask you guys to tell me about why partnerships are so important. I mean, that is the crux of our discussion today. And what we can do to make sure that we have, sustainable development within mental health training.
Partnerships are important because they actually do bring about the development we desire when it comes to mental health service provision. We know that as universities, we offer tuition, we offer programs, we do conduct studies, and that's our area. But we also know that the organizations that are out there that can offer funding, which funding can help actually the implementation of those research studies. Which funding actually can also, in fact, those organizations can even take our students for practical experience, internship, attachment. That's very actually important for us. And there's the government, which is actually the regulatory stakeholder. And it's very important for us to be in partnership with them. In fact, as the university, we are very happy, as the Department of Applied Psychology, at the University of Zimbabwe, we are very happy that from last year, we now have 8 programs, where at the time we had a single running program in psychology. We now have 8, 4 at master's level and 4 at undergraduate level. And at master's level, we are talking of having that clinical psychology master's program, which is very important. At the moment, officially, I think we have less than 20 clinical psychologists who are supposed to offer mental health intervention to a population of about 14 million people. We are trying to say one clinical psychologist is going to provide assistance to 1 million Zimbabweans. So we are there to help in training of the mental health cadres. Now we have even Tanaswa Chikaura. She is our student. She's going to graduate this year. Oh. And we are very proud that we are generating talented people out there. In 2019, we had the World Mental Health Day, which was held at the University of Zimbabwe. And actually, we invited, as the department, we requested our university authorities through our Dean of Students to request the Minister of Health and Child Care then to be able to have the World Health Day held at the University of Zimbabwe. And everyone agreed. But you know what? The idea actually had been sounded to me by Tanaswa Chikaura. So we are saying, if people come together, we actually have a history of working together with the ministry, with various organizations, but we need to get a notch higher. In fact, from last year.
Sorry, Dr. Mija.
The University of Zimbabwe.
We're definitely going to find out. I mean, first of all, we would love to thank you for, bringing up people like Tanaswa here, because now, she's helping us and she's disseminating the information that you've taught her. As you said, she's graduating. I mean, Tanaswa, well done. You are an inspiration. But let's just even find out, Tanaswa, what made you pick mental health? Because some people, again, we've spoken about the importance of partnerships. We've spoken about what's been happening, the different traumas out there. But you, as an individual, what made you decide that, I want to speak out? I want to be the voice for the voiceless.
Thank you so much for asking me that interesting question. When I started doing psychology, I wanted to do organizational psychology. That is the path I had chosen for myself. And I thought I was going to be a human resources manager and all that stuff. And then in my first year of university, there were a lot of suicide cases. When the year ended, a lot of students had died from suicide. And I asked myself, what causes suicidal thoughts? What is it? Where is the gap? What is going on? I wanted to understand. And I did my own research. I did my own literature review to understand the mental health conditions that were there, to identify the gaps and to understand whether the services were available. If the services were available, did students know about it? And I realized students didn't know about it. Students didn't know that there were mental health services available for them, number one. Number two, there were not enough mental health services available for students.
Oh, wow.
And because of that, I decided to become a mental health advocate.
Thank you,
in my mental health advocacy, my main my main aim for me is to not only educate people on what the mental health conditions that are there, but to inform people where they can get services. That's the bridge. There's a whole gap there, and I want to be that bridge.
Thank you so much, Tanatswa. And I hope that the people that are watching this have taken note of some of the free places we've spoken about. We spoke about the Friendship Bench, Phoebe, Christian counseling services. But find Tanatswa if you can't. You know, her full name is Tanatswa Chikaura, and she's at the UZ, as you know, our Dr. Samson Mija has let us know. But I wish we could continue, guys. Talking about mental health is amazing, and at least we've learned a lot, I hope. So we've come to the end of our show. I would like to take this moment, though, to thank our guests for joining our discussion. Thank you. Thank you, thank you, thank you, thank you. And moreover, I'd like to thank, number one, Mr. Fabian Musoro, again, who is the National Mental Health Manager at the Ministry of Health and Childcare. Thank you, sir. I'd like to thank Dr. Samson Mija, who is the chairperson for the Department of Psychology at the University of Zimbabwe. That's Tanatswa's teacher, or was. And Mike Zedi Chikukwa, who is the CEO of Chikukwa Research Trust in Chimanimani. And of course, the lady herself, Ms. Tanatswa Chikaura, who is a mental health advocate. Now, today's discussion was inspired by the United Nations 17th SDG goal, which is to strengthen the means of implementation and revitalize global partnership for sustainable development. Moreover, with a special focus on how partnerships can result in sustainable development within mental health training and the implementation of services. This program was brought to you by Zimpaper's TV network ZTN with the help of our partners, Consolidated Africa Service Private Voluntary Organization, Kaz Pvo. We want to hear from you guys, so please make sure that you share your thoughts and views with us by visiting our Facebook page at Zimpaper's TV network or via our Twitter handle at ZTN News. Now, this was exciting, right? You can also check out Kaz Pvo on their Facebook by searching Consolidated Africa Services Private Voluntary Organization, or checking out their Instagram page, which is kaz.pvo. That's it from us. Stay safe and goodbye. Stay safe again.